When looking at which tendon may be impinged to the rotator cuff, there's a quick test you can do to find out which one is causing you the problem. So if you try to rotate your arm out against resistance, like so, that'll test more of the infraspinatus. If you try to rotate your arm in against resistance, like so, that'll test more of the subscapularis. And then if you push your arm out against resistance, an abduction, it's going to look at more of the supraspinatus. So whichever of those causes you the most pain is going to be the tendon that is being impinged of the rotator cuff tendon. Taking a look at some of the mobility aspects of shoulder impingement, which you may find if you have trouble, if you feel the shoulder is tight, or you feel like you can't get through the full ranges of motion. Now that we've covered those, we're going to focus on more of the strength and coordination aspect of it. The first muscle we're going to talk about is your serratus anterior. It originates on your rib cage right here, and then attaches to the medial border of your scapula. The actions of this muscle are to upwardly rotate, protract your scapula, and also to help prevent winging. This is important as when you elevate your arm overhead, the scapula must upwardly rotate or you will get impingement on that area. As you go into full elevation or abduction, the inferior border of your scapula should come to about midline to show adequate protraction and upward rotation. You must also be careful though, as sometimes the body will protract extra if it is not getting adequate upward rotation as a compensatory pattern. So now we'll take a look at some of the assessments and also some things to help strengthen your
Plank is an
serratus.
excellent assessment tool to look for serratus anterior strength and coordination, as you can clearly see scapular winging in this view. The second phase of the exercise is showing what a good plank would look like to activate or to show good serratus anterior strength. The plank is also a great way to strengthen your serratus anterior muscle to prevent scapular winging. In this exercise is called a wall slide. As you can see, you push gently into the wall to activate the serratus anterior, which would help with the upward rotation of the scapula and preventing impingement during the movement. This exercise is a good way to help activate the serratus anterior when it is not helping to upwardly rotate the scapula in normal movements. This exercise is called a tree hug and is indicated to once again activate the serratus anterior. You attempt to protract the arms, not just push out. So as you can see in the side view, I protract my scapula as I'm going around as if I'm hugging a large tree.
Next we're going to turn our attention to the mid and lower traps. So the mid trap is responsible for retracting the scapula, so preventing that forward shoulder kind of rounded posture. The lower trap is responsible in conjunction with the upper trap to assist with upward rotation of the scapula. So many people have an overdominant upper trap and an inactivated lower trap, therefore leading to kind of a not optimal upward rotation of the scapula. So by getting that lower trap activated, it will assist with the upward rotation, and the mid traps will allow to have the scapulas in the correct plane. Easy exercise for the mid trap is to lay on a ball and then bring your arms straight up to the side with your thumbs up. A good exercise for your lower trap to do the same thing, to lay on the ball and then to bring your arm in an upward pattern like this. They're called T's and Y's. So we'll start with the T and then we'll go to the Y. So we're laying on the ball like so, arms straight out to the side at a 90-degree angle, thumbs pointed up, and you're just going to squeeze your shoulder blades together like so. And that's for the T. For the Y, the arms are going to be out in front of you like a Y pattern. This is a great functional exercise for the lower traps, as you use the lower traps to keep your scapulas down and back while doing a squat. This is perfect for overhead lifters as well. So for the last segment, we're going to take a look at the rotator cuff musculature. Rotator cuff is involved with the supraspinatus, infraspinatus, teres minor, and subscapularis. Together, these do several functions. Subscapularis is more of an internal rotator. Most of the other ones are external rotators of the shoulder, but their main function is to keep the head of the humerus in place and prevent it from elevating, which would cause an impingement of the shoulder. So when these muscles aren't activated, it allows the humerus to upwardly glide and impinge on those tendons. So we're going to take a look at some of the ways that we can strengthen those muscles and work on them to help prevent this impingement. The test that we're going to look at for the rotator cuff musculature is the PICI, point of instantaneous center of rotation, and it looks similar to this. So you use a block or a wedge or a rolled up towel just to make sure that your arm is in neutral. Bring it up like so, and in this position you're going to be rotating your arm into external and internal. And you're looking for two things. You're looking to make sure that this is the center of rotation and it's not moving around, and that the shoulder does not the humerus does not translate anteriorly. So when you see me do this, right here, I start to translate forward. So you're looking for this motion right here. That is considered good, and this one right here is considered bad. So this is looking at rotator cuff musculature coordination that allows the humerus to be held in place and not translate anteriorly. This exact exercise can turn into a treatment just by practicing this coordination nice and slow, using your mid-traps to retract your scapulae and keep that shoulder from rotating anteriorly. To make this exercise more difficult, you can use a TheraBand. So you can strap it around your foot here. This is going to work the external rotations concentrically and eccentrically, and working on that coordination at the same time. Next we're going to run through just a few exercises to work on the rotator cuff musculature and specifically the external rotation. So the most simple exercise you can do, grabbing this, you can either put your thumbs up or thumbs out to the side. I prefer thumbs out to the side. Keep your elbows tucked at your side. Externally rotate out. So for this one, you want to make sure you're getting strictly shoulder external rotation, and then you can also get some scapular retraction at the end of the movement. Another exercise that you can do is start here with your band. Pull it out so you get the external rotation, and slide up into flexion. So it would look like this. And you're keeping that external rotation component at all times. The last one that you can do here, then you're going to rotate up, rotate up. That one I feel like is a real burner because you're holding tension the whole time while moving, so it's more like a dynamic stability.